causes of pee hole pain that may not be related to a UTI. You're convinced you have one, but there's so many other potentials. Hi, I'm your local OBGYN. I love women, and let's talk about it. So, when you get discomfort like burning and pain at your pee hole, you would be right to assume that the highest chance that is causing it is a urinary infection, but it does not have to be that. There's sort of like two subdivisions that we consider when we think about this. There's infectious reasons and non-infectious reasons. So the infectious reasons are obviously like a UTI, but if there's no infection in the pee, it could be an STD, it could be vaginitis, it could be something that is viral, even like herpes acting up in that location, because you can actually see herpes ulcer in your pee hole. So painful for women. Then there's the non-infectious reasons that this can happen, and it can be loss of estrogen like lichen sclerosis. It can be dermatologic conditions. You can even see psoriasis and eczema in that area. There can be lumps and bumps of the pee hole, which can be something like a diverticuli or a stricture in that area. People also have chronic bladder pain syndrome or a vulvodynia that also affects inflammatory markers and pain receptors down there, where you constantly don't have infection, but you have these chronic irritations of that pee hole. And then you get into things like trauma, okay? There are people that do very unusual things, and some people will stick stuff up their pee hole. I don't ask why, but if they show up with it, then we gotta deal with it. If there's something stuck up there, or there's a cut or an injury, or even like an allergic reaction, which is breaking down that tissue over there.